Irritable bowel syndrome affects as many as 45 million people in the United States, and it affects people of all ages, even children. We spoke with Dr. Frank Lee at Redlands Community Hospital in Redlands, who gives us more information on it.
Irritable bowel syndrome is basically the presence of a type of abdominal pain in a patient more in the chronic nature with the following features. One, the abdominal pain usually improves after bowel movement. Two, the abdominal pain, the onset is associated with a change of stool frequency, such as diarrhea or constipation. And third, the onset of that abdominal pain is also associated with a change of stool consistency. And the most important part is that the abdominal pain has no particular organic or structural abnormalities to explain for that abdominal pain. We don't know the exact mechanism of it, but it most likely involves some nerve endings that are in the colon, and that nerve ending sends signals up to the brain when there is pain, and that signals tends to be exaggerated in irritable bowel syndrome patient. Other things that we also look at recently is that maybe the bacteria inside our colon has a role in development of IBS.
And what type of pain is involved?
Irritable bowel syndrome patient can experience different type of pain. A lot of times the pain, the description can be vague, but most of the patient, when they complain of a crampy type of abdominal pain that goes up and down in intensity in waves, and that's usually what they describe. But some people can have even sharp abdominal pain. As far as for structural examination of the gut, such as sigmoidoscopy or colonoscopy, again, in a young and healthy patient without any alarming features, that decision should be made individually based on the signs and symptoms of that particular patient and the discretion of the gastroenterologist. However, patients that are older than age 50 should get a colonoscopy to rule out colon cancer.
Dr. Lee told us how irritable bowel syndrome is treated.
As far as for treatment of the symptoms, when the patient complains of diarrhea, then we call that IBS diarrhea predominant. Then we like to give anti-diarrheal. Some patients experience mostly constipation, then we call that constipation predominant. Then we like to give them osmotic laxatives or fiber supplementation. For patients whose main symptoms is pain, we usually will start out with an antispasmodic medication. IBS is a condition that has no major impact in their lifespan. It's not a serious illness that will affect how long they're going to live.
And how long does irritable bowel syndrome last?
Some people experience short period of time. Some people have longer period of time. However, a lot of people, they have IBS sometimes during their lifetime, and then they disappear, and it never comes back. But some people, they develop it, it goes away, and then it comes back again in different time period of their life. And it's very hard to predict. It's more of an individual of how they deal with the irritable bowel syndrome and how long it's going to be last.